I'm an occupational epidemiologist, and my research and outreach work mostly focuses on occupational health, safety, and well-being, particularly among agricultural workers. I work a lot with dairy farm workers, with migrant farm workers, seasonal farm workers. In the US in particular, we have anywhere between 2.5 to 3 million migrant farm worker families. A lot of the work that we do is also focused on making sure that we try to dismantle a lot of systemic health barriers. Those include transportation to and from clinics or hospitals. This includes cost, the lack of health insurance, language barriers, culture barriers, childcare, also scheduling conflicts. The ag industry, they work from sunrise to sunset. And so by the time they get out of work, your pharmacies, your clinics are closed. The only thing that's open is a hospital, if there is one in the rural places where you live. And then there's also the fear of law and deportation enforcement. So that's a really big one that we also have to make sure that we're sensitive about, but that we don't deter people from accessing health because of that systemic barrier. Some of the projects that we've worked on have really been to empower ag workers and their families to really take health into their own hands. We've done on-site clinics, on-farm, with not only the COVID response, but we've also done Tdap vaccines, which is a very important vaccination, especially when working with heavy machinery and soil. As UT Health, we couldn't have done this alone. We have worked with community partners in all of these rural regions, health and non-health community partners. And we're very intentional about that, about getting everyone involved, facilitating these on-site events, right, to really be able to one by one remove these barriers. And as you could probably imagine, this is a very vulnerable population. So really giving them access to these services and helping them really navigate this very complicated system is what our team has been doing for the past 3 years.